So this is sterile dressing. So I'm going to review my medical order, gather my supplies, which is a sterile dressing kit and a wound measure device. I'm going to knock on the door, perform hand hygiene, introduce myself, identify my client with 2 client identifiers. I'm going to ask them if they're allergic to anything, especially latex, iodine, or shellfish. I'm going to ask if they're comfortable, if they're in any pain. It's not on the rubric, but I would ensure privacy. If they were in pain, I would wait 30 minutes and come back and do the dressing change. I'm going to raise the bed to a comfortable working height and assist my client into a comfortable position. This is an abdominal wound, so I'm going to have them lay back as much as they can tolerate it, just so we can get to the wound, and that may impact the height of my bed. I'm going to lower the rail, get my overbed table closer to me. I'm going to put on a pair of clean gloves. I'm going to remove the tape. If it's sticky, I'll use some alcohol wipes and pull away from their skin so as not to cause any damage. Okay. I'm going to pull up away from my client so that they can't see the drainage. Then this would be sanguineous drainage. It's saturated the 4x4s, but not the abdominal pad. I would fold it in half, dispose of it per my facility policy. Then I would measure my imaginary incision here. Cut that. I would measure my incision. So it is 10 centimeters long. It's healing by primary intention. It has 1, 2, 3, 4, 5, 6 staples. Then I would remove my gloves and set up my sterile field. Can perform hand hygiene after removing my gloves. I'm going to open my package. I can use this as my trash, but my trash is close enough, so I'm going to do that. I'm going to open the package away from me first, then on each side. And then I'm going to come over here so I can put my gloves on. We grab this, step away from my field. I'm going to get this out of my way. I do not need the blue. I'm going to open my swab sticks, grab those out of the package. Get my 4x4s on top of my ABD, and that way I can just go to that section. I'm going to grab my first swab stick. I'm going to start top to bottom, going down the center of the incision. Then I'm going to grab my second one, top to bottom, down the outside. Third one, top to bottom, on the side closest to me. Then I'm going to grab my 4x4s and I'm going to start at the top, put one at the bottom, grab my ABD pad, remove my gloves. I'm going to grab the tape out of my kit, it should have a tab on the end. I'm going to measure the tape, go middle, so we're going to go measure one piece down the middle. Then it doesn't matter one piece top or bottom. I'm going to take my pen and I'm going to put the date. So today is September 13th. It is 11:43. And my initials are FP. I'm going to tape this on an outside part so everybody can see that I did the dressing. I'm going to reposition my client, pull the blanket back up, raise the side rail, lower the bed, make sure my client has their call light, reassess their pain level after the procedure. I'm going to dispose of all of my supplies. Perform hand hygiene. Then I would document in the client's medical record that was a 10 centimeter incision healing by primary intention. There were 6 staples. There was no redness or erythema noted at the site. There was no drainage at the site, but there was sanguineous drainage that had saturated the 4x4s, but not the ABD pad. The patient denied any pain beginning throughout the procedure and at the end. Patient educated client about new dressing change completed using sterile technique.